Every day, hundreds of patients are admitted into Iowa hospitals where they are treated, rehabilitated, and healed. And every day, many of these patients are sent home to continue their recovery. But they don't leave the hospital unprepared, and they aren't left to fend for themselves. Preparing patients for the transition to home is both important and complex. To avoid getting sick and being readmitted to the hospitals, patients are carefully counseled before they're discharged.
The discharge process is when we hand off the patient to their home and to their family members and to any caregivers that we have coordinated their discharge with. Many times there is involvement of a public health nurse so that they can continue to coordinate the care in the home. The patient, at time of discharge, all the education that has been done throughout their hospitalization, this is reinforced. Our goal is to provide the best care possible for the patient and keep them healthy. Also with this, it is to prevent readmissions. A readmission is when the patient has to return to the hospital within 30 days. We track what our readmissions are for and work hard at preventing these.
It's interesting that Medicare did a study in 2008 and identified that about 20% of the time when a Medicare patient is discharged from the hospital, they, for some reason, were readmitted within 30 days. You know, it's something we hadn't looked at in the past. We just thought someone has a medical problem and then they came back because they have some kind of a medical issue. That's true. There's a percentage of the time that patients are admitted because they're medically fragile and they'll have something that brings them back into the hospital. But interestingly, we learned that there's a whole series of other reasons why people are admitted to the hospital. It may be because they didn't completely understand the plan when they left. It may be that they were not capable of understanding the plan when they left. It may have been that their medication was a very complex medication and there were complications in the way that was administered and they had a problem with that. It may have been that their family members didn't completely understand. So what we've learned about readmissions is it's not really about the readmission, it's about care coordination.
Care coordination is when you include all the disciplines in the hospital and then outside of the hospital environment that may be involved with the patient. For instance, the therapy staff, the nursing staff, the pharmacist, the dietitian, the public health nurse, the physician clinic staff, so that everyone is at the same table knowing what the goals are for the patient.
One of Dallas County Hospital's partners in care transitions is Dallas County Public Health and its team of nurses.
Our home health nurses are able to communicate with the family and the patient immediately upon discharge, and then continually with physicians, therapists, pharmacists, other community-based partners in order to surround that individual and that family with all the resources they need to maintain optimal health. Sometimes social barriers will prevent a client from being optimally healthy. So if they're worried about transportation, they can't get back to an appointment, they don't know how to call the pharmacist or when to call that person, or they don't have other social supports like nutritious meals, all of those things, public health can intervene, make sure that those things are taken care of so that the client can be empowered to just be healthy. Communication is the central topic to care coordination. Without good communication, it can't happen. In Dallas County, we have a great system, so our nurses in the hospital and any other of the facilities the patient might enter, along with all of their providers, are able to easily communicate directly about that patient. So if the home health nurse happens to be in the home and is interviewing the patient and they have a concern, they're able to make that phone call immediately, get the information they need, and make changes to the patient's care right in the home.
At Van Diest Medical Center in Webster City, communication between community stakeholders is building trust, coordinating care, and protecting patients from healthcare issues that lead to being readmitted.
The reason we actually started this as a process was because we knew we had some issues with some of our other providers within the community. Our communication just was not where it needed to be.
When Julie first brought this idea to me about we needed to form this transitional care team in our community, initially my response was a little pessimistic because I didn't think that anybody would be willing to participate or interested, and I was very surprised to see how well received it was. Everybody was just kind of waiting, I think, for somebody to take the lead and somebody to organize it.
This team was driven to make some changes in the system. So we have met every month for the past 6-7 months, and I think that has really made a difference. This group has not had any personal agendas that they have carried into this team. Everyone is totally focused on what is going to be best for our patients and making sure that we are working together.
The Iowa Healthcare Collaborative has been very helpful to us in getting this Transitional Care Partners program going, and also, just attending the Hospital Engagement Network meetings, the HEN meetings in Des Moines has helped us also gather information and tools that other facilities have used, and to adjust them a little bit and make them useful for us to use at our hospital. It's just so great to see where healthcare is going, where it's not just you get sick, we take care of you, we send you home. It's more about getting the whole person and getting the multidisciplinary approach to taking care of our patients. It's about keeping people healthier.